So when we talk about the signs and symptoms of any disease, it's a very good idea to draw a representative diagram that helps you to remember the signs and symptoms more easily than just writing them down as a list. So with this small representative diagram, we'll start with the signs and symptoms of iron deficiency anemia. One of the most important sign of any anemia is pallor. Pallor is basically the reduction in redness, the normal redness of the skin. So we can see pallor in conjunctiva, skin, or even the mucous membrane of the subjects. Now, why do we see pallor in the patients with anemia? Anemia is a reduction in the hemoglobin content of the blood, and hemoglobin is responsible for providing the red color to the RBCs. Thus, in the lack of anemia, there is pallor of the skin, conjunctiva, or the mucous membrane. Pallor can also be seen in the nail bed and the creases of the skin, and this is a preliminary diagnostic criteria for most of the anemic conditions. The second important presenting feature of any kind of anemia is fatigue. The blood of anemic patients lacks the ability to carry adequate amount of oxygen to the tissues. Since there is reduced hemoglobin, there is reduction in oxygen to the tissues, and that results in increased fatigue. Now, since there is reduction in oxygen to the tissue, there is compensatory mechanism that sets in, and lungs, they try to compensate by increased breathing. And this compensation actually presents as breathlessness in the patients. Not only lungs but even heart tries to compensate the reduced oxygen to the tissues by increased pumping of the blood, and this in long term may result in hypertrophy or other cardiac abnormalities. The patients with iron deficiency anemia, they have very peculiar oral presentations. If we look at the tongue of these patients, the tongue papillae are lost. So there is reduced filiform and fungiform papillae in the later stages. That results in smooth, shiny tongue, which is also called as bald tongue. Iron deficiency anemia patients also present with angular stomatitis. Angular stomatitis, herein there is cracking of the corner of the mouth, cracked corner of the mouth. These patients may also present with candidiasis, candidal infections. Many of these patients also present with leg cramps, which is an intermittent claudication-like pain. If we look at the nails of the patients of iron deficiency anemia, nails, they have a very typical presentation. If this is the finger and these are the nails, they appear spoon-shaped, spoon-shaped. Not only are they spoon-shaped, but they are also brittle and they break easily. Now the term for this kind of shape of the nails is koilonychia. Iron deficiency anemia also present with something called as esophageal strictures, esophageal web or strictures, that presents with difficulty in eating solid food. So they have dysphagia. There is a term used for The combination of koilonychia, esophageal strictures that is seen in iron deficiency patient, postmenopausal women, and that is called as Plummer-Vincenz syndrome. So Plummer-Vincenz syndrome is nothing but iron deficiency anemia with koilonychia and esophageal web stricture, which is very commonly seen in postmenopausal women. This combination of these features was reported by Plummer and Vinson, so the syndrome is named as Plummer-Vinson syndrome. So these are the most common presenting features of iron deficiency anemia. One more thing that needs highlighting is the Plummer-Vinson syndrome is a pre-malignant condition. And these patients are more prone to development of